Bismillah ar-Rahman ar-Rahim. At first, I would like to thank the organizing committee for inviting me today to participate in this prestigious program, especially Dr. Inji, Dr. Layla, Dr. Wael, and of course my dear colleague Dr. Yasser Abdurraouf. Today, inshallah, we will speak about the relation between weight reduction and the hypertension. This is our agenda for today. We'll briefly speak about metabolic syndrome. We'll speak about weight gain and the blood pressure and mechanism, and weight reduction and the blood pressure, and then we'll speak about different weight reduction methods and blood pressure. Metabolic syndrome, as we are all acquainted with, is 3 criteria out of 5. These 5 criteria are large waist size, which is a mandatory parameter which must be present, and then high blood glucose, high blood pressure, high lipid profile, and low HDL. Lipid profile actually is the increase in the triglycerides. So here we have a relation between obesity and high blood pressure. What is the exact mechanism for increase in the blood pressure with overweight or with obesity? Actually, it is still a matter of debate. It is still a matter of debate. But some studies had linked obesity with activation of the renin-angiotensin system. Others had linked overweight with activation of the autonomic nervous system, alteration in the adipose-derived cytokines, such as leptin, insulin resistance, and the structural as well as functional renal changes. The putative mechanism underlying obesity-related hypertension are complex and they entail interactions between renal, metabolic, and neuroendocrinal pathways. If we are going to summarize this, is this a pointer? We can see that it all starts with in here, excess adipose tissue leads to hyperinsulinemia, leads to OSA or obstructive sleep apnea, hyperleptinemia, and this is a mechanical compression of the kidney and kidney vessels. All of this leads to, as you can see, activation of the sympathetic nervous system and activation of the RAS system, leads to vasoconstriction. Vasoconstriction leads to hypertension, leads to increase in the glomerular filtration, glomerular hyperfiltration, hypertension, and the chronic kidney disease. And we can see all of this is linked together. So now we know that there is a close relationship between obesity and hypertension. What do we know until now? Hypertension is an established risk factor for cardiovascular disease and is common among obese subjects. In Western societies, the prevalence of obesity is increasing, which is likely to increase the burden of hypertension. From the 1960 to 2000, the prevalence of obesity has increased from 13 to 30%. 13% to 30%. In a year of 2000, the overweight has increased also in the adults, and it reached up to 64% in adults. So it's not only obesity, but also the overweight. What else do we know? We know that weight loss has been proposed as an effective non-pharmacological means for primary prevention of hypertension. And we have an early meta-analysis in 1988 shows that a reduction in blood pressure, systolic blood pressure will be reduced to 2.5, diastolic will be reduced to 1.5 millimeter mercury per 1 kilogram weight loss. This is as early as 1988. So what are the weight reduction methods are we aware of? We have lifestyle modification, which combines mainly diet and exercise, pharmacological method, and metabolic surgery. It's not moving? Okay. That leads us to think, what are the proper ways of management of hypertension in obese patients? We have lifestyle management, which we are all aware of, like weight loss, physical activity, correct eating habits, control of smoking and alcohol, and of course we have pharmacological therapy. We have been mentioning the RAS system, we have been mentioning the autonomic nervous system activation, and of course anti-obese medicine. So is it as easy and as simple as that? No. We have to look further into diet control of hypertension in obese patients. We have a meta-analysis of 8 randomized studies. We have to put in mind that once we have diet or exercise, we must depend on meta-analysis because most of the studies include small numbers and we have different methods of diet and different methods of exercise. So what we got here, not only a simple trial, but we must have a meta-analysis. In this meta-analysis of 8 randomized controlled trials, they told us that dietary advice resulted in greater weight loss over from 6 to 12 months of follow-up weight reduction of about 4 kilograms leads to blood pressure reduction systolic of 4.5 and the diastolic of 1.8 millimeter mercury. And also they told us that how long patients maintained this weight loss, they did not study it in this meta-analysis. But we know this was from 6 to 12 months. We have another study. Do weight loss diet affect the blood pressure and reduce the effect of high blood pressure? This is a Cochrane meta-analysis. Actually, once we got a meta-analysis concerning lifestyle, you have to go and search for the Cochrane meta-analysis. What does it tell us? That was performed in 2021, okay? A weight loss diet probably enabled people to lose weight and compared with people who did not follow a diet. And they did not find enough evidence about whether following a diet affected the number of people who died or developed cardiovascular disease. And although people with high blood pressure lost weight and had lower blood pressure after following a weight loss diet compared with people who did not, they did not find enough reliable evidence to be certain about the result. We are uncertain whether following weight loss diet could reduce cardiovascular disease because we did not find enough evidence to look at. So yes, it seems okay. Go along for diet control. It will reduce your blood pressure to a certain degree, but until now, we don't have enough evidence that this would reduce the cardiovascular mortality. And I think, and I respect this Cochrane meta-analysis very much. Which diet? We have many diets. We have Mediterranean diet, DASH diet, Atkins diet, intermittent fasting. We have so many diets. So what did the Cochrane analysis tell us about the diet which our patient should follow? Good evidence suggests that most diets result in similar modest weight loss and improvements in cardiovascular risk factors over a period of 6 months compared with the usual diet. So any diet could work. Weight reduction at 12 months follow-up diminished. So after 12 months, after 1 year of a diet, there was no reduction in the blood pressure and improvements in cardiovascular risk factors largely disappeared except in association with the Mediterranean diet. Okay, so Mediterranean diet here wins the high score, but it shows a small but important reduction in LDL cholesterol. So if your patient asks you, recommend Mediterranean diet as a recent guidelines for hypertension telling us. Okay? As such, moderate certain evidence shows that most macronutrient diets result in modest weight loss and substantial in cardiovascular risk factors, particularly blood pressure at 6 but not at 12 months. So what is the mechanism? How could the Mediterranean diet reduce the blood pressure? There will be an effect on natriuresis, RAS system, reduce adrenergic tone, and increase in vascular relaxation. But until now, the exact mechanism is still not known. How about the exercise? Also, again, we still have a meta-analysis of 24 randomized clinical trial, examined exercise and weight loss in adult patient, outpatient with a mean age of 51. What did they tell us? The participant walked for 38 minutes per day, 4 days a week, and they reached about 70% of the maximum predicted heart rate. And they told us that walking significantly reduced the body weight, leading to significant reduction in diastolic blood pressure, about 1.5, but not systolic blood pressure. The authors did not report whether participant maintains weight loss after the intervention. This is 24 randomized clinical trial. There will be effect in the diastolic, but no effect in the systolic. There's another meta-analysis of aerobic exercise that they told us that the exercise reduced the blood pressure independent of the change in the body weight. So exercise per se will reduce blood pressure, not because of the reduction of the body weight. This confirms the idea that physical activity also reduces blood pressure by mechanisms unrelated to weight loss. Effects of weight on blood pressure at rest and during exercise. The study demonstrated that moderate weight reduction through caloric restriction lead to marked decrease in systolic and diastolic blood pressure at rest and during exercise in healthy subjects. So it's not only with the obese, not only with overweight, but also in the healthy subjects. What is the mechanisms of exercise to reduce the blood pressure? The reduction in blood pressure with physical activity is thought to be attenuation in peripheral vascular resistance, which may be due to neurohormonal and structural response. Other proposed mechanism may be changes in the oxidative stress, inflammation, insulin function, arterial compliance, and RAS system, and also insulin sensitivity. The mechanism underlying blood pressure reduction with exercise and its associated outcomes are still under investigation. So you can see diet and exercise, this is something vague in the sky. Everything is still not fixed as we know from our trials. Why do we have this controversy? Well, because as the antihypertensive response to exercise is highly variable, difference in exercise regimen in all the 24 studies that was examined, environmental factors, genetic factors may be responsible also. And in one study, only some 20 to 25% of those hypertensive did not show reduction in blood pressure during exercise. So study investigating the genetic and clinical factors association with responders and non-responders are ongoing. So we can conclude this by saying that there are so many factors that may affect how people will interact to diet and exercise. Genetic, environmental, and maybe also compliance. I may just be tired of the diet. I will not follow diet after 6 months. I will not follow my exercise regimen after 1 month. So we have so many factors that could interact together. How about lifestyle? Lifestyle is both of them, diet and exercise. We have dissociation between long-term weight loss, intervention, and the blood pressure. This is 18 months. What did they tell us in this study? After 6 months of intervention, diastolic and systolic blood pressure decreased significantly, respective in hypertensive group. After 18 months, the hypertensive group, diastolic blood pressure increased after 18 months, but remained significantly lower than the baseline, and the systolic blood pressure increased and was no longer significantly different from the baseline. So after 18 months, we have no benefit of lifestyle modification. Effect of a modest weight loss in normalizing blood pressure in obese subjects on antihypertensive drugs. In conclusion of this study, they told us that the lifestyle intervention are useful for all obese hypertensive patients, and in most subjects, a modest weight loss is sufficient to normalize blood pressure, avoiding the aggressive use of multiple antihypertensives. So if a patient follow a diet style modification, definitely they will need a smaller dose of antihypertensive. So soon? 15 minutes? So soon? Okay, give me another 2 minutes. Okay, so pharmacotherapy. Of course, we know that the FDA had approved such medications to lose weight, and I need to concentrate mainly on the liraglutide. We know that in the LEADER trial, there had been reduction in systolic blood pressure, but increase in the diastolic blood pressure and increase in the heart rate. We know that liraglutide is approved worldwide for weight reduction, but for hypertension, as you can see, it's not that well marked, especially with the increase in the heart rate. Increase in the heart rate is now one of the factors that increase the risk in hypertensive patients. Also, with those drugs as well will decrease the blood pressure. And this, I brought this drug here forward because when I was preparing the lecture, I noticed that phentermine is a norepinephrine reuptake inhibitor. Theoretically, it should increase the norepinephrine. Norepinephrine is a potent vasoconstrictor. But actually, clinical trials had shown that there had been a decrease in the blood pressure with phentermine. That's why I brought it here, because actually I couldn't find an explanation for this. Okay, malabsorptive agents like orlistat and the fibers, actually they had been associated with cardiovascular benefit and also appear to have risk, but also they improve the blood pressure. Metabolic surgery. Metabolic surgery has proved to be the most effective means of ensuring substantial weight loss, and it had been associated with marked, look at the numbers, marked reduction in the blood pressure. So in conclusion, hypertension is an established risk factor for cardiovascular disease and is common among obese patients. The mechanism for this is complex, and lifestyle modification had been associated with reduction in blood pressure, but this had not been sustained for longer than 18 months. And the metabolic surgery actually is the most potent method of reducing body weight and reduction in the blood pressure. Thank you.